structural and functional change that last longer than 3 months with implications on the health, evidenced by imaging, your electrolyte changes, and serum blood changes consistent with CKD is also called your chronic kidney disease or CKD. Your in under 5 is the commonest cause of CKD is the hypodysplasia, congenital hypodysplasia, Kakut, and also obstructive valvulotomy, say the congenital causes. Afterwards, above 5 years, you have the glomerulonephritis, commonest cause, and the infection. Pyelonephritis remains in both subsets, in both under 5 and above 5. These children have, the your growth failure. They have anemia of CKD. They have CKD metabolic, CKD MBD, mineral bone disease, that is rickety change in CKD. They have infection. They have hypertension in 40% cases in the stage 1 and 2, and 80% of cases in the stage 3 and 4, 5, and beyond. They have uremic symptoms, nausea, vomiting, anorexia, abdominal pain, obtundation, poor neurocognition, and they have, at times, good at one stage, they're going to developing the oliguria and anuria, and they at times, at the good amount, at the end of everything, they turn dialysis dependent. Dialysis is expensive, unbearable by most of the people of the globe, so they need support financially, center, facility, manpower also need to be developed to afford treatment of all cases of the end-stage disease, and underlying cause is to be treated. There are other manifestations, supportive cares like hypertension, acidosis, anemia, CKD, MBD, metabolic bone disease with vitamin D and calcium, and your nutrition by appropriate calories, and then your no protein restriction in children. Basically, adult they do need some amount of protein restriction and less salt and less sugar, and your less fat is good, and then your the ultimately best treatment for the SRD is the transplant is an option. One transplant keeps a patient alive for about 20 to 30 years. 2 to 3 transplant people are saying that they give almost normal longevity and near normal longevity, almost 60 years or so. Dialysis outcome of the dialysis in the developing nations, low and low medium income countries, is average longevity is around 6 years or so. In the West, 18 years or so. So, but expensive. Both the modalities are expensive. Transplant is near normal longevity, near normal life, and they do have some limitations of the quality of life. So all works, all things, everything. They have school failure. These children have school failure. All works cannot be done, and good amount of time. The employment is very poor, but but they need support from the by insurance, by the local fund, by the government sponsored fund, central fund, and logistics, manpower.